yawwa. The Jigawa state government has taken a bold step in addressing malnutrition by launching a comprehensive program in partnership with the Federal Ministry of Health. The 7-day training program, held in Duse, aims to equip health workers with the knowledge and skills necessary to promote good nutrition and healthy practices in rural and semi-urban areas. The state government has made significant progress in reducing stunting rates, with a remarkable decrease of 62.3% since 2018. The Commissioner of Health, Dr. Abdullahi Kainua, represented by the Permanent Secretary, Dr. Kabir Ibrahim, expressed his appreciation for the support of the Federal Ministry of Health and the World Bank, stating that they are committed to providing the citizens with the best possible health care.
Local women who are not able to read and write were empowered to identify, to classify, and to manage different classes of malnutrition themselves and refer those that were using mid-arm circumference measurement as the key tool to identification of malnutrition. And we have seen so many results with this simple approach. You don't have to provide money, you just go to the town without paper, without biro, without nothing. You sit with them and do all the things. Now, getting to this kind of training where we're looking at women, 3 categories of people: maternal, infant, and other children. That's what we are doing here. Again, this is a repetition of facility-based approach in terms of what we do. We need to bring about nutrition-sensitive approaches. And for those of us that are looking at data, evidence for nutrition data, I remember the last time we were in the UK, we were looking at the World Nutrition Report. The contribution of health sector in prevention of malnutrition is less than 10% of the need in terms of the entire sector in nutrition programming, which means 90% of what is required for people to remain well nourished is beyond health as a sector. What is required are issues related to water and sanitation, ensuring that the environment is safe, ensuring that there is social protection, women are empowered, they have money to buy food, ensuring that there's food security within households, ensure that there is no mass movement of people, there is no mass casualty, ensure that people are educated, especially women. Educated women are more likely going to breastfeed, they are more likely going to have empowerment, they are more likely going to go for ANC, they are more likely going to deliver in facility, they are more likely going to have vaccination, they are more likely going to provide the care children look at their level. So when you have your women living within the household where literacy level is less than 70%, how will you get nutrition in order? And that is the missing link again. We are telling the Federal Ministry of Health and all nutrition partners to look at the nutrition sensitive perspective with the view to ensuring we have a sustainable, low-cost, contextualized approach that will go beyond the lifespan of a project, beyond the lifespan of a donor, that is beyond the lifespan of a health facility. And with this, all work put together, resources put together, we're likely going to see those statistics changing in the better for this country, for everyone. This is an area where I have strong interest in my public health career. I can go on talking, on and on around.
On his part, the Director of Primary Healthcare Development Agency, Dr. Shehu Sambo, noted that health workers from local government and world levels have been engaged to address malnutrition in their areas of jurisdiction.
Malnutrition in Jigawa State by bringing in innovations. I don't want to preempt my boss. I'm sure he's going to highlight all that we did, but the commitment that the state and the health workers at all levels, state, local government level, facility level, and even the community are showing to tackle this menace of malnutrition in the house, and even our stakeholders in the communities, our traditional leaders, religious leaders. We have been to so many events and fora to really spread this message, and we were even linking the situation that the North is in of this banditry and security situation, that this situation is not unconnected with malnutrition, that we were not able to tackle up in issues. So I think we are doing a lot, and inshallah we'll do a lot, and we are crossing our fingers to see what the NDHS is going to show to us. We are waiting to see, but we feel that the investment the state has made into tackling malnutrition should begin to show in terms of improving indices around nutrition, and inshallah we are waiting. Even if not much was achieved, we are now more than ever ready to continue the fight with this kind of huge event. This is a huge event in nutrition in Jigawa State, and inshallah we are going to continue the fight and tackle malnutrition. And once again, appreciations to our big visitors, August visitors in July. Thank you very much for that. Thank you so much, participants.
Dr. Ilyasu Salihu, representative of ARIN projects under World Bank sponsorship, commended the state government for its efforts in addressing malnutrition and expressed his organization's commitments to supporting the state in tackling the issue.
Train 2 health workers per each of the basic healthcare provision fund facilities in Jigawa State. All will be funded by ARIN, a World Bank supported project. 2 federal ministers of health. So this is why we are here. The only thing that we need from you is we have faith. If it is nutrition, these are the stakeholders, the nutrition stakeholders. As far as we know in Jigawa State, everybody is involved. Everybody. That's why we come up with up to 60, because you did not allow states to give us just this anyhow. We know who are the stakeholders. We have the mapping, we have the partners mapping. So we have we have mapped all the MDA stakeholders and even development partners that are working in the nutrition space. So that is why we are able to know. But everybody that you are seeing here are state actors. Development partners, they have attended the training at national level, and they are also training their colleagues across the country. Honorable Commissioner, sir, this is why we are here. We need them, but they have given us cooperation right from yesterday, day 1. We were here with them. Look at their age. Up to after 8. After 8, some minutes after 8. Before we ask them to go and rest. And we are here today with them. We will continue to be with them up to we don't know when we will close. But we hope to close any earlier than that. So that cooperation is commendable from them, all of them stay here. We will be here up to the 8 days, 16th of this month, and 2 sessions. Women will be brought from town, 10 of them. We will use them live mothers with their children to do one of the practice. We will go to 4 tertiary, secondary, and primary facilities to also see how they assess feeding of our children 6 to 23 months, and we will also see how they perform food demonstration. All of them sit here, the knowledge they learn, what they learn here, and the skill that they acquire, we will be supervising them and see how they will apply it in those 4 health facilities. We will do that and come back to the class and give them feedback. And the last one is growth monitor promotion session. We will also have that session with them in this class practically before we say yes. We have facilitators that can step down this training in Jigawa State. Thank you very much.
In his part, the State Nutrition Officer Alhaji Said Umar assured that the health workers will do their best to address the issue and noted that the stunting rate has already been reduced drastically since the last survey in 2018.
Their best to prevent the occurrence of malnutrition. And sir, the issue of indices, I think Jigawa State is not the worst in the country, but we are among the worst. We are not the worst, but we are among the worst.
According to Mrs. Eucharia Ike, representative of the Federal Ministry of Health, said that the program is a testament to the power of partnership and the differences they can make when they work together towards common goals.
The commission being represented by the Cabinet Secretary and the Director for Primary Health Care, on behalf of the Federal Ministry of Health, the Coordinating Minister, Professor Ali Pate, and the Director for Nutrition Department, Federal Ministry of Health and Social Welfare. Thank God, and we thank you, sir, for being in our midst today. All along, we have been expecting you since yesterday we started. So we are eager to see you, and we're happy to see you, sir. Sir, the SLO really has summarized what we are in since yesterday. And this is the event that will take us up to 8 days. My same program is more of prevention. And everybody now, both the partners, the Federal Ministry of Health, together with the state actors, all of us are preaching prevention. Because we know how cost-effective prevention is compared to buying a carton of malnutrition, which is used to treat malnutrition. So we are happy and to conduct this training. And this training did not just come like that. Is the dream, outcome of the dream and the outcome of the program we had last year at Ekiti State, where we have 64th National Council on Health, where all the commissioners met, 36 of them, including the Minister of Health that chaired the mission. And on the process, they brought memos, and one of the memos we have for the Federal Ministry is that we are going to institutionalize my SIM program in all the states which are generally accepted. And
with its proactive approach and dedication to addressing malnutrition, Jigawa State is leading the way towards a healthcare future for citizens.